Hello, guys. This is Public Health Talk Series. I am Dr. Bidmos. On today's show, I will be talking about maternal mental health, specifically postpartum depression. Postpartum depression is an important public health topic that affects lots of women around the world, and in some instances, some men do actually experience it as well. So, this topic is actually I can relate to on a personal level. And to help me facilitate this discussion, I have Miss Anne Ogunyomi with me today. I want to thank you so much for joining me on today's episode of Public Health Talk Series.
Thank you for having me.
Yeah, a brief bio of Miss Anne. Miss Anne Ogunyomi is a founder of Postpartum Life Nigeria, and she has a page on Instagram called at postpartumdepression.ng. She's a mother of two beautiful children. She's very passionate about promoting the importance of maternal mental health. She uses her platform to inform, encourage, and educate mothers while helping them to understand that they are not alone. Again, welcome to this show.
Thank you.
As the World WHO indicated, globally, there are about 10% of pregnant women and 13% of women who have just given birth, and they experience a mental disorder, primarily depression. And in developing countries, however, these numbers are higher. About 15.6% experience maternal mental health during pregnancy, and 19.8% experience this after childbirth. And in some rare cases, we have mothers actually commit suicide due to maternal mental health. So on that note, would you briefly tell us what your understanding of maternal mental health is?
Thank you, Dr. Bigman. Maternal mental health is basically a mother's mental health. So when you say maternal, that's talking about motherhood or being a mom. So maternal mental health is a woman's mental health during pregnancy and the postpartum period, that is after delivery. And what is mental health? Basically, a person's emotional wellness and the ability to enjoy life. So it's not just if the person is mentally okay, or if the person doesn't have a mental illness. So how is the person's emotional well-being? How is the person able to connect to other people? How does the person have a sense of purpose? So basically, maternal mental health is a woman's mental health during pregnancy and after delivery or after childbirth.
Yeah. So I said earlier that we're going to be focusing on postpartum depression. So what does that mean to you? What does postpartum depression means to you?
Okay. So I'll give a personal experience, and then from there get like a definition from it, basically. So after my first child, I had a traumatic childbirth, and it's one of the things that usually triggers postpartum depression, which I found later on. And so after delivery, so they usually say when your baby is born, all the pain goes away, and then you're expected to be excited about it and all of that. Now, I was happy that my baby was finally here, but there was there was this sadness there as well. There was crying there as well. There was I wasn't feeling like myself, okay? And then it was out of wanting to know, why am I feeling this way? I started to find, okay, why should my mom would say, why are you crying? Your baby's here. I mean, you should be happy. Some people have lost their children and all of that during childbirth and all of that. They try just as a form of encouragement, basically. But I was happy, but I was glad she was here, but there was no excitement about it. I wasn't feeling myself, basically. And then I found out what postpartum depression was. So your baby, you've been planning for months for the arrival of your child, and then the child finally arrives, and then there's something is missing, basically, or there's a feeling.
So the connection is not there.
There's no connection, there's no, you just I was okay. So I'll give an example of a mom who I'm currently speaking with, and then she's like, she had issues connecting with her child.
Mm.
You know, she just she just breastfeeds the baby because well she has to do it, but there's no connection, there's no excitement about it. You know, there's no basically there's no connection. You don't want to connect with the child. You're sad about it, about the entire experience. You cry a lot. Okay, I think I'm already giving the sense and
Yes,
symptoms
yeah, what it's all
of
about.
depression.
Yes,
You
yeah.
know, so basically, um, you're not depression. Postpartum depression is depression that comes with childbirth. So it's like one of the complications of childbirth that we do not really talk about.
Yes.
So it's like a complication that comes after delivery, after childbirth.
And
So
it differs from one person to the other,
definitely it does.
depending
And
on.
then so it's a complication, like I said, and then like you earlier stated, the numbers are, and these are even reported cases. There are women who go through it and then they do not even know that that's what they are going through because they do not
Absolutely.
even have information. Yeah.
Absolutely, yeah.
So basically, postpartum depression is depression that comes after the child is born. So the child is here, but yeah, which I believe we'll talk about it later on in the discussion. But when baby is finally here, but you're not excited about it.
So
Yeah.
what differentiates it from baby blues?
Okay, so the most significant difference is the time frame.
Yes.
So um baby so as a new mom, like let me use the first time mom as an example. You do not know what to expect with child with the arrival of your newborn.
A child doesn't come
Okay.
with a manual, they say.
No. And then you can even read about it in the books, and but when you experience it firsthand, it's different. It's a different ball game when you experience it. You know, you have sleepless nights and all of that. So you are overwhelmed basically by the needs of the child, by having to heal, by so many other factors. You know, and then this can happen within the time your child arrives and then the first and second week. So when it happens, maybe you're tired, you are crying maybe out of exhaustion from the whole experience. That's okay if it happens within a week or so after childbirth, you know. But when it extends, when it goes into months, so it begins to or it happens 3 months after, it happens 6 months after, then that's depression.
Yeah.
That's postpartum depression. So the baby blues can happen within the first 2 or 3 days, 1 week, 2 weeks. That's still okay. But once it extends beyond that period, then the
Something.
dominant
I
depression.
personally went through the baby blues. Like you said, I mean, you think that now I understand, the difference, but like you said, when you're in that situation, like everything, just like,
Yeah, yes.
it goes out of the window. And I didn't know what it was. And, like you said, I was just like, my first child, I was overwhelmed and, I was snapping at my partner and it was just like, too much. Like, what did I get myself into kind of feeling?
Yeah.
And then I realized that, okay, but thankfully I had, really good support system, and it didn't linger on, like you said, it was just for a short period of time. And, I was able to like get through it. So it's important to know the difference between the two. Like you said, if it lingers on for 6 months or more than that, then it's time to get the needed help. Then we're talking about something different now, postpartum depression, which is something that can be serious, in some instances, because we've seen like, mothers commit suicide because they're not getting the help needed. So what inspires you to actually want to do this, bring attention to or awareness to postpartum depression, maternal mental health in general?
So I'm Nigerian first of all, and then I attended antenatal classes. And throughout although the hospital I registered in, when we go for, they call it mothercraft classes, they usually take their time to talk about important things like maybe, basically, I mean, when we go for antenatal classes, you could see the leaflets of the pages of the information we have to talk about, the things we have to talk about. They're usually lengthy and all of that. They bring professionals to talk and all of that. But nobody is talking about postpartum depression. Nobody is talking about what to do, what's going to happen, or what happens after delivery. Everybody's not and that's my hospital. Some hospitals, all they do is go there and dance and clap and say, this is how you carry your baby. You dance, and then they teach them songs and they pray and they go in circles and dance, and then that's the end. Okay? Now, nobody's equipping the moms for post-delivery. Nobody's saying that things can go south. Nobody's saying, what some people are beginning to say anyway, them not say nobody's saying, but then there's little information about what happens after delivery, and then it becomes a problem because women would begin to feel this way and then they don't know what's going on with them.
Absolutely.
They are equipped with the right information to say, okay, this can actually happen after delivery, or when it's even happening to them, they'll know that, okay, this is why this is happening, and then they can get the right help. So basically, I decided to do this because I didn't have the information before delivery, and it would have helped if I knew that, okay, this is what's going on with me. I know that I'll get through this, so this is what I can do to prevent this. But I didn't have that information until I sought to find the information. Now, with a page like mine, people can get knowledge about what happens after delivery. They would understand that, okay, when people, we live in a society, they'll say, oh, you're a woman. You should let, I mean, the woman is expected or is required to, or there's just this, she's a woman, so she should do it. She's a woman, so she should be able to nurture the child. She's a woman, she was built for this. But mothers and even the people and spouses as well, and siblings, and the society has to just be aware that sometimes the mother is not to it. Sometimes the mother is not mentally okay. Sometimes the mother is actually overwhelmed, and then she shouldn't be put under pressure to deliver on something she cannot deliver on. So when the woman begins to push herself to the extreme because she wants to,
Please everyone.
Exactly, to please everybody around her, then it becomes a problem. And then when she begins to go through postpartum depression, she doesn't even know it. Yeah. She doesn't have the right information.
So would you say there are no resources available in Nigeria where you are in terms of dealing with this?
Okay, so like I said, there has been little research done especially with our society. Most of the research you find will be those done outside the country. But we have women here who go through it. But they're not. I just talked about hospitals, and if they're equipped from the hospital, you go to see the doctors how many times during your pregnancy, including antenatal classes, maybe say 14 visits or more.
And nobody
tells you, you could actually be depressed after delivery. Nobody's saying anything about it. So although some women might be equipped, but majority of the women are not even women, because when you talk to the women, it's important to also talk to others so that they can provide the adequate support to the woman when she begins to suffer from postpartum depression. So no, the society is not equipped with the right knowledge. They can say, oh, why is she behaving like this, or what's wrong with her? Why shouldn't you be happy? Shouldn't you be happy that you have a child and all of that? You should be excited about it. But if those around the woman understand that, oh, she could actually be going through postpartum depression, they could provide the right help. So I believe that our society would eventually catch up with the rest of the world when it comes to postpartum depression. And it will take more talking about it, it will take more
awareness to it,
awareness, building awareness, and talking about it. So when we keep talking about it, people will keep hearing about it, and then mothers will be provided the right support, and then they'll be given the adequate help they desire or they need when they go through postpartum depression.
Absolutely. So what would you say some of the signs and symptoms are when it comes to
So like I mentioned earlier, we talked about the baby blues, and then we say when it begins to extend. So for instance, you are excessively crying you don't know why you're crying, but you're just crying because your emotions are everywhere. You're crying, you have mood swings, and then these are severe cases. You think of hurting yourself, you feel like just leaving everything and disappearing, and you just want to shut everything down. There's this sense of hopelessness, sense of I'm not enough, or basically you just do not feel yourself. You're fatigued. You either overeat or undereat. Excessive weight gain, excessive weight loss. There are a lot of signs and symptoms of postpartum depression, and those are just a few of them.
Yeah, I think that, going back to what you said earlier,
Yeah,
um, family members or loved ones also need to know some of the signs and symptoms. So
exactly.
when they
Yeah,
see it in the nursing mom, they
yeah,
can help her they can understand that, oh, this is what this person is going through, and
yeah,
help the person get the help that they need.
yeah.
So now in Nigeria, now would you consider that postpartum or maternal mental health actually is still a taboo in Nigeria?
Um, so maybe not a taboo. I believe that people are getting aware, and then no, it's well, maybe in some in some parts of Nigeria, like in places where they lack, I mean, basic knowledge. Like
Yeah.
I just spoke about Lagos, for instance, and I spoke about some hospitals in Lagos where all they do is sing and dance. How much more people in the rural areas? I mean, they would also go through postpartum depression now, and then they don't even know what it is. There might be a taboo in places like that, or they might not even understand that it's postpartum depression, you know. So the taboo there would not be postpartum depression now. Well, it would be that, I mean, the mother shouldn't be sad. I mean, the baby is here already, so why is that?
Like
You know,
snap out of it kind of thing.
exactly. So I mean, you should be excited, the baby's here. So maybe not necessarily a taboo. I feel like eventually people would understand. I mean, understanding brings a whole new level to things. So when people understand, you know, they would know that, okay, this is why this is happening. So maybe not necessarily a taboo. I think basically it's lack of the right knowledge or lack of
Yeah.
information.
So
And then,
basically, it goes back to what we said earlier that, there still needs more to be done in terms of,
exactly,
raising awareness on this, and also
yeah,
having resources available for people that actually needs this.
exactly,
Yeah.
yeah, basically, yeah.
So
So,
now I saw this, I thought this was very interesting. So
mm,
around 1 in 10 men experience what they call partner postpartum depression
yeah,
after the birth of their child.
yeah.
So yeah, the focus is really on women. So why is
Mm.
that?
Okay. So I think I believe that is because men are usually expected to, be a man. I mean, or be a man, and they'll be like, even when men are not, when you say man, you hardly see men crying, even when they go through emotional or when they are emotional or anything, because they'll be like, "Oh, you should be a man, you should, you're a man, you shouldn't shed tears, do you understand?" So I believe number one is basically because the society has the society already has this notion that men should be men,
Yeah.
men um, shouldn't be emotional basically, and then so men are not expected to have emotions. Postpartum depression doesn't present itself in men the way it does in women. So people do not really identify it in the men, and then the men probably also tend to hide behind them being men, and then they don't want to show emotions basically.
Yeah,
So
absolutely. That's the reason why I wanted to shine a light on that.
said, okay, the take home message, like we said earlier, would be that um, it's important for those around the woman or the mother to ensure that they provide adequate support. I believe that one of the one of the reasons or one of the reasons why women go through depression is stress, or stress trigger these things, and the woman having to go through hormonal changes and body changes, psychological, physical changes would have great impact on her mental well-being. But if those around her can provide her with the support she needs, it will go a long way in helping her. That's for those around the woman. Now for the woman, um, do not undermine the way you feel. Do not it's not your fault that you have postpartum depression. It can happen to anybody. And the earlier you speak up, the earlier you try to get help, the better for you. Um, because we find that postpartum depression, if left untreated, would graduate to postpartum psychosis. That's what you mentioned earlier about women having to kill their children, and then it's just a mental problem, you know.
That is it for today. Thank you so much for joining me today, Stu, and sharing your personal experience. Um, that was Ms. Anne. I want to thank her so much for joining me today to provide personal experience and share what she knows about maternal mental health, specifically postpartum depression. And if you have, or you're feeling you have some of the signs and symptoms of postpartum depression, please seek help. And it is real. Real people experience it, and there's no shame in asking for help. If it's left untreated for a long period of time, it can lead to something bigger. So if you feel you have the symptoms, or you feel that your loved ones are showing symptoms of postpartum depression, please have them seek help. And if you want more information on this topic, such as the signs and symptoms of postpartum depression, you can check out our website. The link is in the bio. And we have some information on postpartum depression on the website. On the next video continues to practice the preventive measures in place, and continue to keep safe and stay positive. Thank you guys so much. Take care. Bye-bye.